Syphilis has cast a long shadow over human history. This serious infection, caused by the bacterium Treponema pallidum, has left its mark on societies around the world. For centuries, syphilis remained a mysterious and devastating illness. It ravaged bodies and minds, leaving lasting damage in its wake. The fear and stigma associated with syphilis were as palpable as its physical symptoms. Syphilis spreads through intimate contact, primarily through sexual activity. The bacteria responsible for syphilis are highly contagious. They thrive in warm, moist environments, making transmission through sexual contact easy. Once inside the body, the bacteria multiply and spread, leading to a range of symptoms that can vary in severity. The impact of syphilis extends far beyond the individual. Left untreated, syphilis can have devastating consequences for both personal and public health. It can lead to severe organ damage, affecting the heart, brain, and nervous system. In pregnant women, syphilis can be passed to the unborn child, resulting in congenital syphilis, a condition with potentially life-threatening complications. Throughout history, societies have grappled with the burden of syphilis. The disease has touched the lives of people from all walks of life, leaving its mark on art, literature, and culture. Understanding the history of syphilis and its treatment is essential for appreciating the progress made in medicine and public health. It is a reminder of the importance of continued vigilance in the face of infectious diseases. Before the advent of antibiotics, treating syphilis was a perilous endeavor. Early practitioners resorted to a variety of methods, often with more harmful than helpful results. One of the most widely used treatments was mercury therapy. This approach, based on the belief that cures involved administering mercury, a highly toxic substance, to combat the disease. Mercury was administered in various forms, including ointments, pills, and even vapors. The logic behind this treatment was flawed, as mercury's toxic effects were often mistaken for a sign that it was working against the disease. In reality, mercury therapy caused severe side effects, including mercury poisoning, which could lead to organ damage, neurological problems, and even death. Another approach involved the use of guaiacum, a tropical wood extract, and other herbal remedies. Guaiacum was believed to have sudorific properties, inducing sweating, which was thought to expel the disease from the body. While less toxic than mercury, guaiacum and other herbal remedies proved largely ineffective in eradicating syphilis. In the early 20th century, a desperate and unorthodox treatment emerged: malariotherapy. This method involved intentionally infecting syphilis patients with malaria, a parasitic disease. The high fevers induced by malaria were thought to kill the syphilis bacteria. While somewhat effective, malariotherapy was a risky procedure, as malaria itself could be fatal. It was a last resort, employed when other treatments had failed. The early 20th century marked a turning point in the fight against syphilis with the development of salvarsan, the first effective chemical treatment for the disease. Developed by German scientist Paul Ehrlich, salvarsan was an arsenic compound that targeted the syphilis bacteria without causing the severe toxicity of mercury. Salvarsan, also known as arsphenamine, was a significant breakthrough in the field of chemotherapy. It paved the way for the development of other drugs that could effectively target specific pathogens. While salvarsan was a major advancement, it was not without its drawbacks. The treatment involved multiple injections, often painful, and could still cause side effects. Despite its limitations, salvarsan represented a major victory in the battle against syphilis. It offered a glimmer of hope for patients who had previously faced a grim prognosis. The discovery of salvarsan spurred further research into chemical treatments for infectious diseases, leading to the development of more effective and less toxic drugs. The impact of salvarsan on syphilis treatment was profound. It transformed syphilis from a potentially fatal disease to a manageable condition. The success of salvarsan demonstrated the power of scientific inquiry and innovation in addressing global health challenges. The landscape of syphilis treatment was forever changed with the advent of penicillin in the 1940s. This powerful antibiotic, discovered by Alexander Fleming, proved to be highly effective against the bacteria that cause syphilis. Penicillin marked a turning point in medical history, ushering in a new era of antibiotic therapy. Penicillin works by interfering with the bacteria's ability to build cell walls, essential for their survival. This action effectively kills the bacteria, clearing the infection from the body. Compared to previous treatments, penicillin was remarkably effective, safe, and easy to administer. The introduction of penicillin revolutionized syphilis treatment. It offered a cure for a disease that had plagued humanity for centuries. Penicillin's effectiveness, combined with its relatively low toxicity, made it the gold standard for syphilis treatment. It remains the primary treatment for syphilis today. The impact of penicillin extended far beyond syphilis. It became a cornerstone of modern medicine, used to treat a wide range of bacterial infections. The discovery and development of penicillin stand as a testament to the power of scientific collaboration and the importance of investing in medical research. Section 5. Modern syphilis. Treatment: clear paths to recovery. Today, syphilis is a highly treatable disease thanks to the effectiveness of penicillin and other antibiotics. Early detection and timely treatment are crucial for preventing the long-term complications of syphilis. Treatment guidelines have been established to ensure consistent and effective care for patients diagnosed with syphilis. The standard treatment for syphilis remains penicillin, typically administered as an injection. The dosage and duration of treatment vary depending on the stage of the disease. For early-stage syphilis, a single injection of penicillin may be sufficient. Later stages may require multiple injections over several weeks. For patients allergic to penicillin, alternative antibiotics such as doxycycline or ceftriaxone can be used. These alternative antibiotics are also effective in treating syphilis but may require a longer duration of treatment. Close monitoring by a healthcare professional is essential to ensure treatment success. Modern syphilis treatment goes beyond simply eradicating the bacteria. It also focuses on managing any complications that may have arisen from the infection. This may include addressing organ damage, neurological problems, or other health issues resulting from syphilis. Section 6. Recognizing the stages: syphilis through the lens of time. Syphilis is a complex disease that can manifest in various stages, each with its own set of symptoms. Understanding the different stages of syphilis is crucial for early diagnosis and effective treatment. Early detection and treatment can prevent the progression of the disease and the development of long-term complications. The first stage, primary syphilis, typically presents with a painless sore, known as a chancre, at the site of infection. This sore usually appears within 3 weeks of exposure, but can take up to 3 months to develop. The chancre typically heals on its own within a few weeks, even without treatment. However, the absence of a sore does not mean the infection is gone. Secondary syphilis, which can occur weeks or months after the chancre heals, often manifests with a rash, fever, swollen lymph nodes, and other flu-like symptoms. These symptoms can come and go over time, making diagnosis challenging. If left untreated, secondary syphilis can progress to latent syphilis. Latent syphilis is a stage with no visible symptoms. The bacteria are still present in the body but are not actively causing damage. This stage can last for years, even decades, without any outward signs. However, latent syphilis can still be transmitted to others and can progress to tertiary syphilis. Tertiary syphilis is the most serious stage of the disease and can occur years or even decades after the initial infection. This stage can damage the heart, brain, nervous system, and other organs, leading to severe health problems. Section 7. Public Health and Prevention. Breaking the chains of transmission. Public health measures play a crucial role in controlling the spread of syphilis. Efforts focus on promoting safe sexual practices, increasing awareness, expanding access to testing and treatment, and supporting at-risk populations. By addressing the social and behavioral factors that contribute to syphilis transmission, public health initiatives aim to reduce the incidence of this preventable disease. Comprehensive sexual education is paramount in preventing syphilis and other sexually transmitted infections. Educating individuals about safe sex practices such as consistent condom use, reducing the number of sexual partners, and getting tested regularly empowers them to make informed decisions about their sexual health. Early detection is critical in controlling syphilis transmission. Regular testing allows for timely diagnosis and treatment, preventing the spread of the infection to others. Public health programs often provide free or low-cost testing services, making it easier for individuals to know their status. Contact tracing is another essential tool in syphilis control. This involves identifying and notifying individuals who may have been exposed to syphilis so they can get tested and treated if necessary. Contact tracing helps break the chain of transmission and prevent further spread of the infection. Section 8. The importance of early detection, catching syphilis before it takes hold. Early detection of syphilis is paramount in preventing the long-term consequences of this treatable disease. The sooner syphilis is diagnosed, the more effective treatment will be in preventing irreversible damage. Understanding the importance of regular testing and recognizing the early signs of syphilis can make a significant difference in an individual's health outcomes. Regular testing for syphilis is particularly crucial for individuals at higher risk of infection. This includes people with multiple sexual partners, men who have sex with men, and those who engage in unprotected sex. Routine testing allows for early identification and treatment, minimizing the risk of complications. Recognizing the early symptoms of syphilis is also essential. The primary symptom, a painless sore called a chancre, can easily go unnoticed. However, if detected early, syphilis can be treated effectively with a single dose of penicillin. Being aware of any unusual sores or rashes, especially in the genital area, and seeking medical attention promptly, is crucial. Public health campaigns and educational initiatives play a vital role in raising awareness about syphilis and the importance of early detection. By promoting regular testing and providing information about syphilis symptoms, these efforts empower individuals to take control of their sexual health and seek timely medical care. Section 9. A treatable disease, a preventable future. Syphilis, once a feared and devastating disease, is now a highly treatable condition thanks to medical advancements and public health initiatives. The discovery of penicillin revolutionized syphilis treatment, offering a cure for a disease that had plagued humanity for centuries. Today, with effective antibiotics and comprehensive treatment guidelines, syphilis can be effectively managed, preventing long-term complications. Preventing syphilis requires a multifaceted approach that encompasses individual responsibility, public health measures, and access to health care. Promoting safe sex practices, such as consistent condom use and reducing the number of sexual partners, remains crucial in reducing syphilis transmission. Public health programs play a vital role in syphilis control and prevention. Expanding access to testing and treatment, raising awareness about the disease, and implementing contact tracing measures are essential components of a comprehensive approach to tackling syphilis. Syphilis serves as a reminder that infectious diseases remain a significant global health challenge. Continued investment in research, public health infrastructure, and educational initiatives is essential for maintaining control over syphilis and other preventable diseases. By working together, we can strive for a future where syphilis is no longer a threat to public health.